Welcome to Health Literacy Out Loud. I'm Helen Osborne, President of Health Literacy Consulting, founder of Health Literacy Month, and author of the book Health Literacy from A to Z. I also produce and host this Health Literacy Out Loud podcast series that focuses on many aspects of health communication, patient education, and health literacy. Today, I'm talking with two guests. Doris Zallen is Professor Emerita of Science Studies and Humanities at Virginia Tech. Her research explores personal and family and societal issues arising from advances in genetic testing and gene therapy. Doris is the author of 2 books about genetic testing and is developing online tools to help people make informed choices about such testing. In all her work, Doris draws upon the experiences of genetic professionals and everyday people who are making decisions about genetic testing. The other guest is Jamie Tyrone, who has been a patient advocate for many years, and this started after she accidentally learned that she has the gene that puts her at high risk for Alzheimer's disease. Ever since, Jamie's advocacy has taken many forms, including as a research participant, a co-author, and member of several professional committees. Jamie wrote a book about her experience, and the title is Fighting for My Life: How to Thrive in the Shadow of Alzheimer's. Welcome to you both to Health Literacy Out Loud.
It's nice to be here. Thank you.
Thank you so much for inviting me. This is Jamie.
So thank you for this. Let's start all about genetic tests. That's what brought you two together. I gather you two didn't meet each other until after this story starts unfolding, but the common link has to do with genetic testing and genetic tests. Would one of you explain what genetic tests are and why they're used and why people get tested?
Well, this is Doris. Genetic tests are used to reveal what particular genes we have inherited from our parents, and often what particular effects they may have. Some of them are kind of modest genes that may affect hair color or eye color. Others can put us at risk for certain illnesses, either early in our lives or later in our lives. So they can be kind of a crystal ball of what might come health-wise in our lives.
And Doris, I've got a question about this. When I go to the doctor just for routine stuff, I have blood tests, I have blood pressure measurements, they take my, they do all that routine stuff. Nobody's ever said to me, well, actually somebody did say to me after I was diagnosed with something, they said, do you want a genetic test? How often does this come up in everyday situations?
Over time, it's more and more common, but still not terribly common. But it's possible to have genetic tests on your own outside of the medical community through online companies that offer all kinds of genetic ancestry testing or health testing.
Oh, okay. Jamie, I have a feeling that this brings you into the story. Can you talk about genetic tests from your perspective? Now, you are not in the healthcare field. You're not a scientist, right? Your world is something else.
Well, actually, I am a registered nurse.
Oh, okay.
But I have not practiced nursing in 20 years, so please don't ask me to put a Band-Aid on you. So
okay.
How I found out my genetic test is that I decided to participate in a study that said the premise was if you knew you were at genetic risk for certain diseases, would you change your lifestyle? And at that point in time, Alzheimer's wasn't even on my radar screen, but MS was because I was having some neurological issues. So I eagerly signed up for the study, hoping that I would find a piece to this medical puzzle that I was dealing with.
Just a study that was out there because you thought you might have that.
It was an NIH funded study,
okay.
And it was actually published. So, but there was no genetic counseling involved, even though it was designed to have genetic counseling involved. So I knew nothing about anything. And this was 15 years ago when 23andMe was first had received FDA approval right after my experience. So one night I'm sitting at my computer and the results pop up. And I'm so excited to get the results. And I'm looking at it, and I had very, very little risk for MS. But yet, if I looked on the other side of the test, it showed that I had 2 copies of ApoE4. It's an allele of the ApoE gene, and which at the time, I, of course, had been and did a Google search because I wanted to know what it meant. I was by myself. My husband was at work late at night, and there was only one study, and that was published by Duke University, said that my risk of getting Alzheimer's disease was 91%.
Oh my goodness.
Yes.
And so you went into let me just capture this. You went into this kind of wondering your risk or, your association with this other chronic disease.
Correct.
Found out, and then so you just signed the forms, like they must have asked you to sign something.
Exactly.
Right?
It was the informed consent was all online, and it's rather like you know how you want to download an app and you're like, yes, I want it.
Right.
And you just
agree.
peruse
Yeah.
it, and that's exactly what my experience was. And mind you, to put this in context, at this point in time, my great-grandmother, grandmother, 2 great uncles, and my father was passing actively with Alzheimer's disease, and he passed a few weeks later. So it just was, I had a very, very guttural reaction to this. And this is how I actually met Doris, because I had a very dear friend. She was in a bookstore, and Doris's book basically fell in her arms. And
okay,
that was
let's just put a pause. Okay.
Sure.
So you're home, you're all alone, you do not have that dread disease you were worried about, but oh my goodness, you had this thing, you didn't even really know what it was. You did your own research, and oh my goodness. And it sounds like a stressful time in your life too.
Horribly.
That's the situation that you're in. Doris, so I know there's this connection between this book. At this point, are you aware of situations like Jamie's going through? Is this an everyday thing, or is just kind of a one-off happening just for Jamie?
Sadly, it was not uncommon. When about 40 years ago, I was a lab scientist trying to develop new genetic tests. And this was before DNA testing became common in medical practice. And I met with people who were families with a particular disorder I was concerned about. And I discovered through them that many people are happy to get genetic information, and other people are unhappy, don't want it, or feel threatened by it. And that started me on a journey, an academic journey, to find out, what is this about genetic testing? Well, I, don't hear people complaining about getting a blood pressure test or a hemoglobin test.
Right.
But what is it about genetic testing that causes some people to be eager to have the information and other people to be threatened and unhappy with the information? And so over the years, I've conducted hundreds of interviews with genetic professionals, but also, as you mentioned earlier, Helen, with people who have made decisions about having genetic testing or not having it, and people who look back on those decisions after some months or years. And I learned that genetic information is very complicated. It can have good aspects to it for people. It can have devastating aspects. It can have personal aspects. It can affect family. And it can affect one's privacy and workplace and other kinds of situations. So it's very complicated, and one should never just plunge into genetic testing. Some genetic tests may be appropriate and useful, others may not be. You really have to think about it.
Okay, so your origin of this piece of it was an academic interest.
Yes.
You started gathering stories from many perspectives, and so you wrote this book.
Oh, actually 2 books. The first
Two books at that time. Okay.
Yeah. The first book was at the time, for more rare diseases like cystic fibrosis or Tay-Sachs disease. And then as the field of genetic testing grew with DNA testing, it was possible to learn about genes that predispose you to an illness, raise your risk. But having the gene doesn't mean you'll get the disease, because these are common health problems like cancer and heart disease and Alzheimer's that have environmental components as well. So you can have the gene and not get the disease, and you can get the disease without having the gene. It's complicated.
It's complicated. All right. Thank you for that overview. And we will have a link to your book or your books also on your Health Literacy Outlet webpage. Jamie, getting back to your story now. You have this test result. I can't even imagine what that is like. What happened at that bookstore?
Well, it was my girlfriend, and she had known what I was dealing with. And at one point, I actually was suicidal. And
Oh, my goodness.
it's sad for me to say that, but I was.
Because of the genetic testing results.
Correct. I felt there wasn't any hope. I did not want to know this information. I lived with it every day. I was afraid that my husband was going to have to take care of me, which I did not want. I'd seen that too many times. So my girlfriend, who was a very special person in my life, she was in a bookstore, and the book fell out of the shelf into our arms, and it was called To Test or Not to Test. And that was the book that Doris had written.
To test or not to test.
When I read Doris's book, it really saved my life in the sense, truly, because it validated that my reaction was normal for an abnormal situation. And I decided one day that I was going to hunt Doris down. And so I found her email address, and I emailed her, and she called me right back.
Wow.
And we had this long conversation, and I was able to take a big sigh of relief and understand what this actually meant to me. And I had the validation, and she gave me the courage to start my advocacy, become a research participant, and to make something positive out of something that was very stressful for me.
Wow, what a story. And you two have stayed connected ever since. I mean, you're doing this podcast with me together, which is fabulous, but I see other work that you've done together too, each in your own way, from your own perspectives. Thank you both for sharing your stories and for all you've done and are doing, and I'm sure will continue. Let me tell you a little bit about this podcast series and the audience. So this podcast is all about health literacy, which really refers to communicating health information in ways that patients and the public can understand. You're bringing in two key perspectives, both as an academic and a researcher and as a person with this lived experience. The listeners to this podcast might be clinicians, they might be in public health, they might be working at community agencies, or they might just be interested and happened upon this topic. What would you like to share with them about genetic testing?
Well, I'll jump in. This is Doris. I think you have to accept the fact a genetic test is a more complicated decision than other kinds of standard medical tests.
Okay.
It has positive aspects for some, negative aspects for some, a mixture for many people. It has personal effects. It has family effects. It can affect your job, your insurance. It is very complicated. And it's the bottom line is you have to think about it in advance. Don't plunge into it because it's fun and somebody gave you a gift card for having a genetic test. You have to think carefully about what the test will provide, how it will affect you, how it might affect your family, and give it time to percolate. Don't jump into a yes or no in 10 or 15 seconds. You have to understand that you might decide that some genetic tests are right for you and will be beneficial as you make healthcare decisions, and others may not be right for you or not right at a particular time. So it's an obligation from the perspective of the patient who is thinking about, should I have the test, as well as for the medical community. who are offering tests to give people time to understand the full dimensions of what a genetic test is and what it isn't.
So let me frame this in terms of health literacy. And so many of the folks listening are the communicators in such situations, and they want to do a good job. You've done an excellent job kind of outlining some of those parameters about what makes this so complicated in there. I am very curious about ways to communicate this complicated information more clearly. And when you talked about all the implications, I'm also thinking it's a lot about numbers. It's about numbers and risk and probability that alone are overwhelming in there. And there's a lot to convey. So I want to get your tips about what might make it easier for someone to get that information so they can make an informed choice. Jamie, before we get into those kind of design and wording tips and communication tips, what would you want listeners to know?
So I am a true and staunch believer of a robust informed consent.
Okay.
And that I will use an example of another genetic situation regarding this. So my mother had 3 types of cancer. She had pancreatic, breast, and melanoma, and she eventually succumbed to pancreatic cancer. It was suggested to me that I get tested, genetic testing. Now, having gone through my Alzheimer's testing, which was very traumatic, I really had to think about this because did I want to know? It came down to numbers because I still am not confident with the numbers that if I do something to change my lifestyle, that I'm going to be able to prevent Alzheimer's disease. There are studies that are coming out there that support changing lifestyle. That's fabulous, but I'm a numbers person and I want to know by exactly how much. But with the pancreatic cancer, I was told, and I spoke with a genetic counselor, and the genetic counselor spent a lot of time with me trying to decide whether or not I was ready to know this information, especially knowing my past history, and what I would do with this information. And because of the combination of my mother's cancer, I concluded that I should probably get tested because I could increase my surveillance.
Okay, all right.
And it was actionable. It was solid, actionable information that I could do something about.
I admire your bravery. You had such a horrible experience the first time to say yes the second time.
Well, thank goodness I came back without any of the genetic markers for the pancreatic cancer.
Good.
But that doesn't still mean that we haven't discovered one that might affect it. So I still do active surveillance and I work very closely with my primary care. So I feel like I'm in charge on this one.
Oh, okay. Well, both of you, I'm so glad we're meeting in that way. As far as that informed consent and communicating the complexity and the risks and the benefits and the mixture all more clearly, in an ideal informed consent, what would that look like?
Can I answer that, Doris?
Yeah, well, it's complicated because the genes are different and have different effects and different risk numbers with them. I think what we learned, my team and I at Virginia Tech, was that people learn in different ways.
Mm-hmm.
And you have to acknowledge that and respect that when you're giving genetic information. Some people want a picture of something visual that they could see. What is the risk if I have the gene, if I don't have the gene? Some people like every last word, every printed document. They're information seekers. You have to find ways to provide that. Some people want to hear the information. So what we ultimately did for Alzheimer's disease, and this was inspired by Jamie's experience, was we put together an online website that helps people think through the decision. Doesn't make the decision for them. It outlines the factors that you have to think about as you are making your decision. And of course, we recommend wherever possible to consult with a genetic professional, such as a genetic counselor, who can put all those things together and help you think through the particular dimensions of your own personal and family situations. So it's a multifaceted approach. There's no one way fits all. Because people learn differently and think differently, and that has to be respected when you're giving genetic information. And numbers are particularly hard. Risk factors. I mean, Jamie was given a risk factor of 91%. First of all, that was wrong. It was an early study. But anything that comes with a number that precise, 91%, it sounds so accurate, doesn't it?
Right.
Not about 90% or more than 50%, 91%. And now we know that there is a higher risk for people who have 2 copies of the E4 risk gene, but it's about 50%. It's much,
Oh,
much less than that. But that's not the information Jamie was given. And people have a problem with numbers. Some people do. And you have to be careful how you present numbers. On our educational online tool, we do it with pictures and words. So people can understand that having the gene raises your risk, but doesn't guarantee that you'll get the disease.
Jamie, what would your ideal consent look like?
Well, as Doris talks about her consent that she created, and which I had no clue she was doing this, it is an interactive tool. So it has 2 people sitting, a question is asked, and they each have a different perspective. So they get the whole conversation of what may resonate with that person. And once the tool was online, I took the test and I put my mind where it was at the time that I found out. The recommendation would have been that I needed to seek more information to make a decision for myself. Now, as I look at the tool, because I'm farther along the line, I'm like, oh my goodness, we need to take this tool and translate it into a lot of different educational information regarding whether or not we want to know our blood-based biomarkers or other information that's still new and out there, and disease-modifying treatment. So that is what looks like a good tool for me if it's something that needs to be done online, because there isn't a maybe professional within my community that can help me through it, a genetic professional, that to have an interactive tool to get you to think, decide, take it back to your family, discuss it with your family first. My family was a little upset by this information, and my sister didn't want to know, and she didn't want to get tested. My niece, her daughter, went and got tested and found out she carries a copy. It was very, very upsetting. So this tool, if my family could have looked at this tool, then they could have decided for themselves. And I think my niece would have made a different decision.
Thank you. And we will have a link whenever the tool is available on your Health Literacy Out Loud webpage. I also just kind of bring this to a close at this point, or a semicolon, because there's so much more to say about this. But you talked about some of the strategies that work. I'd like to add, perhaps this podcast can help in some ways. We are having a conversation. We're having a conversation including both of your perspectives about genetic testing. And I'm bringing in, I hope, the questions that many people responsible for these forms, or, or giving them out or writing them, are asking from health literacy. I think it exemplifies some of that interaction. It's not dynamic. I mean, it's one time. And I know you have a lot of resources out there. You've got your books, you've got your talks, you've got your websites. We're going to have links to all of that. I really believe, and I say this sometimes, where health literacy is bigger than any one person or program or profession. Together, we can all make a difference. And I'd like to think for genetic testing, the 2 of you and everyone else you're working with, together, we are making a difference. Thank you so much for being guests on Health Literacy Out Loud.
This is Doris. Thank you. It's been a privilege to have this conversation.
Yes, this is Jamie. Helen, thank you so much for giving us the opportunity to share our experiences to help other people navigate their journey through genetic testing.
As we just heard from Doris Zallen and Jamie Tyrone, it's important to consider even complicated topics like genetic testing and all its many implications. But making sense of it all is not always easy. For help clearly communicating your health message, please take a look at my book, Health Literacy from A to Z. Feel free to also explore my website, healthliteracy.com, or contact me directly at helen@healthliteracy.com. New Health Literacy Out Loud interviews come out the first of every month. You can get them all for free by subscribing at healthliteracyoutloud.com or wherever you get your podcasts. Please help spread the word about Health Literacy Out Loud. Together, let's tell the whole world why health literacy matters. Until next time, I'm Helen Osborne.